Case reports. What is a case report? It is a detailed report of the symptoms, signs, diagnosis, treatment, and follow up of an individual patient. It may contain a demographic profile of the patient, but usually describe an unusual or novel occurrence. Case reports are professional narratives that provide feedback on clinical practice guidelines and offer a framework for early signals and effectiveness, adverse events, and cost. They can be shared for medical, scientific, or educational purposes. Here you can see an example of how a case report is. Some case reports also contain a literature review of other report cases.
So let's talk about strengths and weaknesses. Strengths. So one strength is the ability to detect novelties. It's the only way to present unusual and uncontrolled observations on symptoms, clinical findings, course of the disease, complications of interventions, disease associations, secondary effects of medicines. Everything that is rare and has never been published before. A case report can synthesize readers and therefore facilitate the detection of similar or identical cases. A recent discovery is the successful treatment of infantile hemangiomas with systemic propranolol. This discovery was published as a case report in the correspondence section in New England Journal of Medicine. Another strength is solving ethical constraints. Case reporting can be valuable when ethical constraints prohibit experimental research. As an example, the challenge of how to manage the side effects of accidental extravasation of cytotoxic drugs, as randomized clinical trials on humans seem unethical in this clinical situation. Generating hypotheses. A new hypothesis could be formulated. This can be tested with formal research methods to confirm this hypothesis. An example of this is a case report about the devastating side effect of thalidomide in congenital abnormalities. Rare diseases in randomized clinical trials can be impossible to run due to lack of patients. Therefore, less rigorous methodologies can be used, among them case series and case reports. Doctors can continue medical education. An example is demonstrating the diversity of manifestations between medical diseases and syndromes. The cost of doing a case report is low compared to planned formal studies. Also, the time of observation to publication can be much shorter, thus can alert to the medical community about diseases. Also, case reports have flexible structures. Case report can lead to contribute to a change in clinical practice. A drug might be withdrawn from the market. Also, observations published can generate ideas and be a trigger for further studies.
Weaknesses. The first weakness of this study is that there are no epidemiological quantities. So this means that the cases are not chosen from a representative population and they can't generate ratios, rates, incidence, or prevalence. But they can signal a causal association between exposure and outcome. Causal inference is not possible. You cannot infer from an uncontrolled observation that you can have a cause and effect relationship because this could be a coincidence. This is a limitation common on all descriptive studies. The cause effect require planned groups to extend control, bias, and co-founders. Generalization is not possible because you need a cause effect relationship and a representative population, and in case report, you doesn't have it. Bias. Publication bias is a limiting factor because in the treatment area, they publish only the positive outcome factors. Emphasis on the rare. It deals mostly with atypical diseases and it could divert the attention from common diseases. Confidentiality. Before the publishing, patients need to sign an informed consent, but there is no guarantee that there is a full confidentiality for the patient. He could be recognized by someone. Other limitations. The reports are produced retrospectively. Medical record could not contain all the data, having a recall bias. Also, the observer's subjectivity might bias the interpretation of the observation. The falsification cannot be applied to case reports because you cannot reproduce the experiment. Thank you.